Hi, my name is Vanessa Garcia, and I'll be doing my presentation on center of pressure and muscle activation. Some background before we get started, we will be discussing a lot about osteoarthritis of the knee. It is the most common form of arthritis and affects our older age population. About 21 million people have osteoarthritis, and it's really painful. It causes a lot of inflammation and muscle weakness. This pain, stiffness, muscle weakness influences the activity of your limb and how much the muscles are able to contract. We'll also be talking about orthotics and the effects it has on center of pressure. So the purpose of the research article, Foot Center of Pressure Manipulation and Gait Therapy on Lower Limb Muscle Activation in Patients with Arthritis of the Knee. The purpose of this study was to determine whether center of pressure manipulation along with gait therapy would affect the muscle activation of our lower limb muscles. It had two parts, the first being whether the manipulation of center of pressure would have an immediate influence on muscle activation. The second being whether prolonged gait therapy would have an effect on muscle activation and kinetics on barefoot. So post therapy, whether there was a difference in muscle activation of the foot. So 14 female participants with bilateral medial compartment osteoarthritis were taken. They had to have this medial osteoarthritis for 6 months or more without having knee replacements or musculoskeletal or neurological pathology. The women were of relatively older age, about 59 years old, give or take 6 years, and the data was collected through an EMG analysis, barefoot, and with a biomechanical device, as seen in the picture above right here. This is the APOS system that has two rubber convex elements that can be adjusted to distribute the center of pressure in different ways. The women walked 10 meters 6 times with 4 different calibrations. The first being here in A and B, a functional neutral sagittal axis, C, no rubber convex elements, D, a lateral sagittal axis, and E, a more medial sagittal axis. The EMG took the muscle activation of 6 different lower leg muscles for the 10-meter walk of the 4 configurations, as well as post gait therapy. So the women did a 3-month gait therapy where they walked for 30 minutes every day with a specific configuration of this APOS system. So they took the EMG after that therapy, before that therapy, and with the APOS system. And the results found that the highest muscle activation, the highest ARV value, was with a medial sagittal axis configuration. You can see that it has the greatest ARV value compared to the other 3 configurations. And with a more symptomatic knee, the lateral had the least ARV compared to the other 3 configurations. These 2 data tables that compare the 6 different muscle groups with 4 configurations during specific phases of a stance. Table 4 more specifically shows the baseline ARV compared to after 3 months of gait therapy, and found that in your more symptomatic leg, after 3 months of gait therapy with the APOS device, there was a greater peak activity of your medial gastrocnemius. So the analysis and discussion portion of this research article essentially said that the center of pressure manipulation positively influences muscle activation patterns, as well as a 3-month gait training program. These 2 combined essentially increase muscle activity, decrease the duration of the muscle activity, which would help induce more normal activation patterns. So these people with osteoarthritis, their muscles around their knee are able to have a greater activity, lower activation, lower duration of the activity, and have more normal activation patterns. Their hypothesis was supported in that the muscle activity would increase with the training. So some real world application, gait therapy and shifting center of pressure to a more medial side would help increase muscle activity of these patients. And ultimately the women had medial compartment osteoarthritis, and their medial gastrocnemius was able to have greater activation. So this is a good thing. Ultimately, these people with osteoarthritis with the gait therapy are able to achieve normal activation patterns and can have a more healthy, active lifestyle. This research article, along with many others that have been taken, can positively influence how we design orthotics to help support these individuals a lot more. This is the reference for the research article. Thank you so much for listening. I hope you enjoyed.